Hello everyone, we're going to discuss conjunctivitis today, but first a quick note about the structure of the eye. The conjunctiva is a thin clear membrane that covers the inside of your eyelid and the white of your eye, which is called the sclera. Its function is to protect the eye and to help lubricate it by producing mucus and tears, and it also protects against invading organisms. So conjunctivitis, or informally called pink eye, is an inflammation of this membrane lining presenting with erythema, which is redness, dilated conjunctival blood vessels, and various other symptoms such as discharge and itching, depending on the cause. So let's now discuss each type with treatment strategies. Number 1, bacterial conjunctivitis. So symptoms for this one, we've got an acute onset, so the symptoms go on quite rapidly. Patients report grittiness, burning, a foreign body sensation, a purulent discharge, and blurring. Eyes can quite often be glued together first thing on a morning. There's usually not much itching, or if there is, it's quite mild. It can be one or both eyes that are affected, and it seems to affect children more commonly. Most common pathogens in children are Haemophilus influenzae, then Streptococcus pneumoniae, and Moraxella catarrhalis. In adults, it's more likely to be the staphylococcal species. The pathogens are directly transmitted onto the conjunctiva when the epithelial layer is compromised. Contact lens wearers are more susceptible to gram-negative infections such as Pseudomonas, H. influenzae, and Moraxella. Slit lamps are beneficial in diagnosis but not usually available in primary care. So diagnosis is based on clinical symptoms in uncomplicated, non-recurrent cases. The patterns of spread are hand to eye contact to fomite. A fomite is just an inanimate object or passive vector that can transfer a disease to a new host once contaminated with an infective agent, and person to person through respiratory droplets. So with treatment, consideration should be made to the benefits of treatment versus letting the condition just run its natural course, which is usually resolution of symptoms within a week, in uncomplicated mild cases. This is to aid with antibiotic resistance and microbial stewardship. Antibiotics should be provided in more complicated cases, such as in those who are immunocompromised, contact lens wearers, suspected gonococcal or chlamydial infection, and symptoms resolve usually within 5 to 7 days with treatment. So the antibiotic treatments are on the screen there. These are based on UK guidelines, so it might differ in your country. We have first choice would be chloramphenicol, and then second line would be fusidic acid. All courses are 5-day courses. And there are some cautions with the chloramphenicol specifically. There are limited studies in pregnancy, and in breastfeeding it is not advised at all. Those with personal or family history of blood dyscrasias, including aplastic anemia, should avoid, and people who are hypersensitive to the ingredients or active substances should also avoid. STIs, sexually transmitted infections, can cause conjunctivitis. Now, symptoms of eye problems caused by STIs are usually much more severe with prolonged mucopurulent discharge. Examples of the bacteria include chlamydia trachomatis and Neisseria gonorrhea. So with chlamydia, this can be passed on to the infant during birth, and they'll present about 5 to 14 days after birth with ocular symptoms. With gonorrhea, there can be a high risk of complications such as uveitis, corneal perforation, and severe keratitis. Now let's move on to the viral causes. We have mild to moderate erythema, petechial or pinpoint subconjunctival hemorrhage, and mild to moderate pruritus, and less discharge than the bacterial causes, it's usually more watery. We have erythema of the palpebral or bulbar conjunctiva. The palpebral lines the eyelids, and bulbar is just found on the eyeball over the anterior sclera with lid edema. Follicles are also more common. These are round collections of lymphocytes on the lower eyelids. You can just see them. If you pull down the eyelid, you'll be able to see them there. And patients may report a foreign body sensation. Symptoms can often be associated with an upper respiratory tract infection as well. We should mention the herpes virus here. Symptoms can be indistinguishable from other viral causes. Usually presents with unilateral red eye with vesicular lesions on the eyelid and watery discharge. Lesions may be present on the tip of the nose. This is called Hutchinson's sign. And in contact lens wearers, inflammation is usually under the upper eyelid, and topical fluorescein can be used to identify epithelial defects. Now, acute non-herpetic viral conjunctivitis is usually self-limiting, no antibiotics required, and 1 or 2 weeks symptoms usually resolve by themselves. Self-care measures include bathing, cleaning, cool compresses, lubricating agents and artificial tears. On to allergic now. We have eye redness, which is also called hyperemia injection. Quite intense itching. The eye and the surrounding tissue are usually affected, and it's usually bilateral. Discharge, watery and clear, no stickiness. And if there is any discharge, it's reported to be slightly stringy and rope-like. There's usually a burning sensation and stinging, but no pain. Enchymosis, which just means swelling of the eye surface. There may be a history of atopy, such as allergic rhinitis, dermatitis, and asthma. If itching isn't present at all, an alternative diagnosis may be necessary. The bulbar and tarsal conjunctiva may bulge over the lid margin. Lovely. It's triggered by allergens such as pollen, pet dander, or dust mites. And it does look like my points on the slide are all mixed up in my notes, so they're not in order. I'm sorry about that. Really sorry. Hope you can forgive me. Moving on to treatment now. We have ocular antihistamines. The first one is antazoline, which only exists in preparations with xylometazoline. It's a sympathomimetic agent to constrict the blood vessels and reduce redness. To be avoided in narrow angle glaucoma and for a maximum of 7 days, as you'll get the rebound redness occurring. Next, we have mast cell stabilizers such as sodium bromophycate and lidoxamide. Ages and directions are on screen there. We also have drugs that have both properties listed there as well. Some side effects such as Zelestine, you can have irritation and a bitter taste. Ketotifen, which causes burning and stinging and dry eyes, dry mouth. And olopatadine, which can cause irritation, headache, dizziness, and a dry nose. What advice can we give to patients then? Soft contact lens wearers should not use their lenses while they have symptoms, and care to be taken when they use the eye drops as well. The bacteria that causes bacterial conjunctivitis can be very contagious, so try and prevent spreading, wash hands frequently, and don't share towels and flannels, that sort of thing, and avoid close contact with others. The crysts on the eyes can be removed by wiping. Just use cooled boiled water on a cotton wool pad, wipe the area once, then throw it away and then repeat. The UK Health Security Agency does not recommend exclusion from schools or nurseries unless there's an outbreak, as children do miss a lot of school generally due to illness, but each school and nursery may have their own policy. The patient will need to be referred to ophthalmology if symptoms persist more than 7 to 10 days after initiating treatment for a swab. And finally, warn patients who drive or operate machinery to take care after using drops or ointments, as their vision may be blurry for about 5 minutes afterwards.